question. A 28 years old patient presents with right angle pain and swelling following a fall from the ladder. Injury occurred today morning around 9 a.m. He applied ice, but there is a huge swelling at the inner side of the ankle. In the emergency department, physician ordered X-ray, which shows a bimalleolar fracture. The fracture is reduced by ED physician after discussing with the orthopedic surgeon. Quote the service performed by ED physician. So here it is the service performed by ED physician. Okay, this procedure, this everything, evaluation and management procedure, everything is performed under emergency department section. So you have to take code from that section. Okay, that you have to keep in mind. Now take your MDM is not directly given, so take your MDM table, identify the problems given in the question. So it is given as right angle pain and swelling. So right angle pain swelling means pain and swelling are some minor problem. Then the physician have ordered X-ray. And what is the diagnosis? It is bimalleolar fracture. A fracture comes under which section? The fracture comes under acute complicated injury. Okay, if it is a sprain means we can categorize it into acute uncomplicated injury, but fracture comes under acute complicated injury. Okay, so when you get two minor problem and one acute complicated injury means don't consider the minor problem, you can consider the acute complicated injury. This one acute complicated injury comes under moderate of problem table. Okay, then next come check for the data table. What all are the investigation procedures? Anything performed? Physician have ordered one X-ray. Okay, so one X-ray is ordered. Then the physician have also discussed the treatment with the orthopedic surgeon. Okay, so that comes under category 3 of moderate as well as high. Okay. Then ordering an X-ray comes under category 1 of moderate as well as high, but we cannot consider category 1 because only 1 point is okay. You need to get at least 3 points to consider category 1. Hope you got that point. So you cannot take category 1 into consideration because here only one X-ray is or imaging study is ordered. So you cannot consider that. Okay, but you can consider category 3 because the physician, ED physician have discussed the management option with the orthopedic surgeon. Okay, so since one among the category 1, 2, 3 is covered means you can choose it as moderate, not as high. Okay, so problem table, it is moderate. Then data table, again it is moderate means you can finalize it as moderate itself. So ED department with the MDM of moderate complexity, the code is 99284. Moving on to next question. The chief complaint is osteoarthritis flare up in both knees. History: an established patient is here today with continued pain in both knees due to osteoarthritis. Left knee bothers her more than her right knee. She has been having this issue for over a year. She is requesting a steroid injection. She uses one over-the-counter ibuprofen daily. No weakness or numbness. Then examination part is there. You read it. I have already told you that examination part doesn't have much importance as of now. Okay. Then assessment, as above with what appears to be continued progression of primary osteoarthritis of knees. And the prescription is given, prescription of Celebrex antibiotic is given, not given for work today as well. So MDM, it is not given straightly. We have to identify it comes under which MDM. So what is the problem? Problem here is osteoarthritis flare up in both knees, which means osteoarthritis is a chronic condition which affects bone. Okay, then it flare up means the symptoms worsen. Okay, that is the meaning of flare up, or the condition is worsening. Okay, or the symptom is getting more and more severe. That is the meaning of flare up. Okay, and in the assessment it is given as continued progression of primary osteoarthritis of knee. So this primary osteoarthritis of knee is that condition is more and more getting worse. That is the meaning. Okay, so it comes under which section? It comes under acute exacerbation of chronic condition. Okay, so in the problem table, this acute exacerbation of a chronic condition comes under which category? It comes under moderate. Okay, so problem table, you got it as moderate. Then in the data table, we don't have any investigations ordered or reviewed or independent historian or nothing is there. So keep it there and go to risk table. In the risk section, what management option that the physician choose? He have prescribed medicine, right? Prescribed an antibiotic. Prescription of a Celebrex means prescription drug management. So prescription drug management comes again in which category? Moderate. Okay, so in the problem table you got moderate, the risk table you got moderate, means the MDM level is moderate, and it is clearly mentioned in the history as it is an established patient. So established patient with the moderate MDM is 99214. Next question. A patient Samuel comes to office of a physician Dr. Kens. Samuel is having diabetes mellitus for the past 2 years. He usually consults a diabetologist, but he is on leave now. Dr. Kens looked into his previous report and also advised to take a HbA1c test. Doctor conducted all physical examination. Pallor, jaundice, cyanosis absent. Respiratory system normal. Cardiovascular system normal. Integumentary system normal. Then Dr. Kens, after all the examination, told him to continue his medication without fail. How do you quote the E&M service of Dr. Kens? So here, what is the problem? The problem is diabetes mellitus for the past 2 years, which means it is a stable chronic condition. Okay, it is a stable condition, and today there is no symptoms of any exacerbation, means it is a stable chronic condition. Okay, so one stable chronic condition comes under in problem table low, one stable chronic condition. Okay, then next is data table. Data table, what all Dr. Kens have looked? He have looked into previous reports, which means he have reviewed previous reports. That is one point. Then also he have ordered HbA1c test. That is another point. Okay, so 2 points is there, ordering of a test as well as reviewing of his previous report, which comes under category 1 of a low. Okay, category 1 of low is satisfied. 2 of the below is satisfied, means category 1 is okay. Please look at the data table and read it. Okay, so in the data table again you got low. So in the problem table low and data table low means it is a low MDM. Okay, and is he a new patient or established patient? He was a patient of a diabetologist, but today he consulted a different doctor, that is Dr. Kens, and he is just a physician. It is not mentioning that he is of the same department of the other physician. Nothing is mentioning. So this is a different physician. He may not be same speciality of the diabetologist. Okay, so therefore this is a new patient. This Samuel is a new patient for Dr. Kens. Okay, so the answer is 99203, new patient with the low MDM. Next question. A 56-year-old new patient has controlled diabetes, controlled hypertension, presents to office with complaint of fever, frequent urination, also pain in bladder, groin region. Physician documented as acute urinary tract infection. Physician prescribed antibiotics after reviewing the urine test. Code the E&M service. So identify the problems. The problems given here are controlled diabetes, controlled hypertension. What is controlled hypertension and diabetes? They are stable chronic conditions, right? So two stable chronic condition is mentioning there. Then many minor problems are mentioning: fever, frequent urination, pain in bladder and groin region. Then what is the conclusion of these minor problem? It is the conclusion is acute urinary tract infection. So this acute urinary tract infection is a uncomplicated illness or injury. One acute uncomplicated illness or injury. Okay. So one acute uncomplicated illness or injury comes under low, but controlled diabetes and controlled hypertension comes under moderate. Two stable chronic condition comes under moderate. So in the same problem table, if you get low and moderate, means you have to consider moderate. Okay, so the problem table you got moderate. Then it is given as the physician has reviewed the urine tests, but it is not mentioning how many tests are reviewed and nothing like that. So just only one point, it cannot be categorized into low or moderate in data table. Now you just go to the next one, risk table. What is the treatment management option that the physician have taken? The physician prescribed antibiotics, so the prescription of antibiotics comes under prescription drugs management, so that comes under moderate in risk table. Okay, so in the problem table you got moderate, then in the risk table also you got moderate, and it is clearly mentioned that it is a new patient, means ENTM of a new patient with a moderate level MDM 99204. A 42-year-old female who is a new patient presents with foul smelling urine, increased urine frequency, flank pain and fever for 4 days. So the patient is having many complaints: foul smelling urine, increased urine frequency, flank pain, fever, which is present for 4 days. Patient denies nausea and headache. Provider performs the following examination in addition to height and weight. And some examination part is given. You read it your own. Then the patient is prescribed ciprofloxacin and given diagnosis of acute cystitis without hematuria. So the patient is given one antibiotic prescription, and the physician have finally given a diagnosis: acute cystitis without hematuria. So MDM is not directly given, we have to find out. So for that, first we have to identify the problems. So here in the starting, many minor problems are given, and also in the ending as the diagnosis, it is given as acute cystitis without hematuria. So acute cystitis without hematuria comes under one acute uncomplicated illness or injury. Okay, so one acute uncomplicated illness or injury means it comes under low of a problem table, right? Then in the second part, data table, it's not given any investigation part or any ordering or reviewing of test or any independent historian or nothing is given in the data table. So it is straightforward. The data table part is straightforward. On to risk table, identify what management option is taken by the physician. So here it is given as medication prescription of an antibiotic, ciprofloxacin, which comes under prescription drug management, which comes under moderate of the risk table. Okay, so in the problem table you got it as low, data table you got it as straightforward, risk table you got it as moderate, means if three of them are different, one is straightforward, other one is low, and other one is moderate, means you have to consider the intermediate level, which is the low level. Okay, so the MDM is of low level and it is a new patient, so the code is 99203.